Welcome to this video. This is a very important video because in this video, I will share with you a step-by-step approach for outstanding ERAS 2024 application. So if you want to know all the key points and most importantly, all the new changes which you must be aware of, keep watching. So why ERAS application is important? Because your ERAS application is representing you. The program directors do not know how much sacrifice you made to come so far, how brilliant and how dedicated you are. The only way to communicate your achievements, your dedication, your commitments to the programs where you want to match is ERAS application. So this is extremely critical to get interviews and make a strong impression. So I say it that use it or lose it. Disclosure, I'm not a professional resume writer, and in this video, I will share with you a couple of medical associations. Their resources are completely free of cost. However, I don't have any relevant financial relationship with them. Remember, you cannot apply to program until your applications has been certified. Most importantly, once you have submitted your ERAS application, you cannot make any changes besides only personal information. So this is very important to know how to write an outstanding ERAS application flawlessly, because you cannot make any change after you submit it. In this short video, I will go through a step-by-step approach to create your outstanding ERAS application. And the sequence I will discuss all the headings is same as real-life ERAS application. Secondly, I will also share with you a couple of important points for personal statement, how to create letter of recommendations, and I will also share with you a couple of key takeaways. In this video, you will see all the new changes which has been brought for this 2024 ERAS application. So stay tuned. Your name should match your official ID. For some cases, international medical graduates, they may have long middle name. Maybe that is not included in the ID. If this is the case, make sure your name, which you are writing to the ERAS application, matching to your ID. And to never use PO box as your address. For email address, I will advise you to use a separate email address because you will get a lot of email regarding ERAS application. It will save your time because you do not have to look through multiple email to find out that is specific email. Always use a professional email address. This is not the time to be creative. So the best option is use your first name and last name, then your preferred email account. That will be my recommendation. There will be some other additional information they will ask after the previous section, that is additional information about Six Sigma, Alpha, Omega, Alpha. Majority of the cases for international medical graduates, the education system do not have this status. So if you are an IMG, you do not have it, do not sweat on it. It's all good. Next section is language. Be careful to highlight the specific proficiency level of any particular language which you are claiming for. For example, if you are fluent in Hindi, make sure that, okay, how much you are fluent, because they will ask the level of the fluency. Language section is very important because many times language could be one of the common questions during the interview. So if somebody is claiming that know about that specific language and not able to do communication, do the conversation in that specific language during the interview, as you can understand, that already gives a red flag to the interviewer. Geographic preferences. This is a new section for 2024 ERAS application. Geographic preferences is an unique opportunity for the candidates to give signal to the programs of particular region. For example, if you want to go to programs in New York, in Pennsylvania, and Mid-Atlantic region, you can give signal to them. Important to remember, if you choose that you do not have any division preferences, then all programs where you apply will see your response as well. So this is a great opportunity for you as a candidate that, okay, if you have any particular geographic preferences, maybe for your family demand, for your personal choice, you can do that. Next section in the ERAS application is medical education. This is very important. And as we know, for matching, year of graduation is very important because most of the program has cutoff of year of graduation. However, year of graduation is nothing in our hand because if you are more than 7 years now, for example, you cannot change it. It's like age. So what you can do in that situation is strive for high USMLE steps score. Even though USMLE step 1 is now only pass or fail, there are USMLE step 2 CK as well as step 3. Hands-on clinical US experiences, research experiences, good letter of recommendations, preferably a large number from US licensed physicians, and then publications. These are some important things you can do to optimize your chance to get interviews despite your year of graduation more than 3 to 5 years. Truly, if you are in that situation, I will recommend you not to dig into the past because we cannot change the past. Our aim is to do that what we can do now with whatever we have. The next section is postgraduate training. You can highlight if you have any postgraduate training. These are some organizations. If you have membership, most of them offer free membership for students. If you have membership with your medical associations of your back home, that you can highlight as well. For medical school awards, I will advise you not only just list the award, give the context. For example, if you were the best intern, tell them among how many interns were you selected and who selected? Were you selected by the faculty? Were you selected by your peers, nurses? Giving the context of the awards goes a long way. Then the next section is other awards. Be conservative about bringing your high school awards unless that was extremely significant, for example, at national or international level. For other awards, I will advise you to mention awards that show your enthusiasm as well as cultural minds. This section is extremely important, and I want to bring your attention that in this important section, ERAS made 2 big changes. One, in contrast to the last year application, where applicants had no limited number of experiences, they could enter as much as they want. Secondly, here, as you can see, they have included 3 most meaningful experiences, along with including only 10 selected experiences. So among those 10 experiences, you will choose 3 most meaningful experiences. In the selected experiences, you can choose under work as clinical, teaching, volunteer, and research. For volunteer, it does not have to be always medicine related. For experiences, we know that hands-on experience goes a long way compared to the observership or shadowing. Because as an intern, this is expected that you will be able to take care of, at least give the preliminary treatment of certain number of patients, usually 8 to 10, as well as able to do documentation of note, able to do multidisciplinary work with nurses, physical therapy, and other professionals, along with working with your attending physicians, as well as other consultants. So hands-on experience goes a long way compared to observership. If you do not have hands-on experiences or externship, you have only observership, then mention that in your selected experiences. The description of experience is vital. And so what did you mention in this section? The main point you should highlight that truly what did you learn? Which skill did you develop? It could be case presentation, learning the electronic medical record like Cerner, then clinical knowledge through didactics, for example, grand round, morning report, time management, teamwork with physical therapy, occupational therapy, social worker, then patient counseling. For example, giving a bad news, counseling about a specific disease or a new medication. One very important point I want you to remember from this video that when you are writing the description, always use active verbs because these give power to your writing. These are the examples of some of the useful active verbs. If you simply Google it as list of active verbs, you will be able to get so many of them. Some other points regarding description that do not keep the description box blank. Always be clear and concise because there are limited characteristics. And this is my personal opinion that bullet points are very easy to read. So I will recommend you to go 3 to 5 bullet points for description of each experience. Truly, at the end of the day, this is your personal choice because if you believe that you are better in writing in paragraph, please go with that. Ultimately, whatever you are comfortable with. Meaningful experience is another new changes for 2024 ERAS application. So among those 10 experiences, ERAS is now highlighting 3 experiences as most meaningful. So do not only repeat the same description because here they are asking simply that why these 3 experiences are meaningful among those 10. Then the next new section is impactful experiences. As you can see the screenshot which I took from the real ERAS application, that it could be either of them, like your family background, if you are coming from low-income family, if you are the first generation coming with very less educational opportunities. So you can highlight this. In my opinion, this is very important to explain that how these challenges, setbacks make you a better person, which skills did you learn, because they simply are interested to know which skills from this experience you will bring during your residency to their program. Next section is presentation. It could be oral presentation, poster presentation. Remember, case presentation should not be counted in this section. The volunteer experience does not have to be all medicine related. It could be community contributions outside of medicine, some teaching or mentoring. Hobbies, some people may tell that, okay, I will never mention about hobbies in my ERAS application. However, if you can show that you have a creative hobby that can set you apart from the other pool of candidates. And that could be easily a beginning question of your interview. Although if you enjoy Netflix or video game, this is not the place to mention as the hobbies. Program signal is another new point in this ERAS application. So this program signal number depend upon your specialty. And this is the way you are giving the signal to express your interest in that particular program. So for example, for internal medicine, you can give signaling to 7 programs. In contrast, ortho, they can give signals to 30 programs, at least as of this year. So when you are giving the signal to particular programs, do your research, be realistic, and try to match that program's expectation and previous history according to your credentials. For example, if you have a score of 220 for CK and your year of graduation is more than 7 years, and you need to find out a program who is taking applicants or took applicants past years almost similar to these characteristics. Another example will be if you are an IMG, find out that, okay, which programs have interviewed and also matched IMG's previous year. So this is a very important signaling system that you can give interest to the programs. And if you can do it well, truly it will be helpful to get the interviews. This section may sound very simple. However, if it is missed, that will not look good on anyone's application. So be mindful about spelling, grammar, punctuation, articles. Make sure to proofread, and after you proofread, give it to a friend or maybe a family member to proofread as well. Always, if you're not sure, always double check it. Another important point that sometimes we may forget, that capitalize cautiously. Take a look at this line, which is written in red color. It's difficult to read, so know when to capitalize the line. I would like to end this video with some key takeaways. However, before that, I want to share a few points regarding the letter of recommendations and personal statement. For letter of recommendations, always please ask early. And when you are asking for letter of recommendations, give your CV. Next point about personal statement is that always do it in one page and make sure to proofread it, because ERAS does not have any system for spelling check, grammar check, or article check. So what I would recommend you to do, write it in a Word document and then copy paste it. So for ERAS application, truly the key is to have clinical and research experiences. Then make sure to save it, because if it is not saved, the new changes will be lost. I do not want you to be in that situation. Use active verbs, because these give power to your writing. Bullet points, in my view, are very easy to read, so use it cautiously. 3 to 5 will be an ideal number. And I cannot emphasize enough how important this is for you to revise your ERAS application. So I hope you found this video helpful. Please like this video, give your thumbs up. That truly give me satisfaction that, okay, your time was worthy. Please subscribe to this channel, because your subscription gives me motivation to make more useful educational videos for you. If you have any question, comments, please put it in the section below. I will see you in the next video, and I wish you all the best for your application. Stay tuned.